Hi, my name is Jill Pogodzinski. I am the Director of Community-Based Pharmacy Services for Kaleida Health. Kaleida Health is Western New York's largest hospital health system, and Kaleida provides comprehensive medical services to the community, including retail chain pharmacies known as family pharmaceutical services. The longitudinal opportunities that we offer are offered out of our pharmacy called High Street Pharmacy. We are located in Buffalo General Medical Center, which is one of the hospitals of Kaleida Health. It's on the main medical campus downtown at 100 High Street, and it is a 480-bed hospital with a focus on cardiac, neurology, bariatric, ambulatory surgery, and many other types of acute patients. So in addition to the community patients that are walk-in that we serve, or from the clinics within our health system that we serve, we do serve an amount of acute care patients that are coming out on discharge, which I'll talk about. So we offer a variety of rotations that you can mix and match and turn into a longitudinal opportunity. The first that we offer is the traditional 4-week community rotation. So although it is a 4-week community rotation, because when you're a community pharmacist, you are touching on every aspect of healthcare every day. Even on the 4-week community rotation, you will be touching pieces of what I'm about to describe in the elective opportunities as well. So the mandatory rotation that you would do here would be a 4-week community. The other rotation that we offer is an elective. It's transitions of care and medication therapy management. So transitions of care is born out of our Meds to Beds discharge program, which is a very robust program we've built over the last few years at Buffalo General. So our Prescriptions Plus program, as it's called, serves about 50 to 70 patients being discharged per day, anywhere from 100 to 200 prescriptions per day. So there is a dispensing piece where you're doing what I call a manic med rec at the time of discharge. So there is a clinical opportunity that you have about 15 to 30 minutes to intervene, make recommendations to the provider at the time of discharge, and we deliver the beds, bedside, and counsel. Then 3 to 5 days after that, we contact all of our high risk for readmission patients, and we do medication reconciliation, medication therapy management, and then our residency program is moving into enrolling patients into disease state management as well. So all students that come through on an APPE will be working with our resident in the residency program, who is expanding our clinical work that we're performing at the community pharmacy. So we have a transitions of care elective that involves MedRec, MTM with follow-up, and a little bit of a disease state management. The other opportunity we have for an elective is consultant pharmacy. So part of Kaleida Health is the Visiting Nursing Association, which is a home health agency. These are nurses that go into patients' home and provide care. So a lot of it is transitional. It's not a skilled nursing, so it's not 24-hour care. Home care is when someone just needs a transition from hospital to home, or is a long-term patient that needs assistance in the home, but they have to have a caregiver that is there with them that can supplement what our nurses go in and provide. So the role of our FPS pharmacists at the VNA is that we have a high risk conference. So as hospitals are always looking to reduce 30-day readmissions, so is the VNA. You know, when we take a patient onto service at the VNA, our goal is to keep them healthy in their home and not have a readmission to the hospital. So the role of the pharmacist at that high-risk conference is the VNA clinical nursing directors identify patients who are at risk for readmission. And there's a multidisciplinary team that meets weekly. And it includes nursing, PT, OT, home health aide, dietitians, social work if necessary, speech therapy, and then a pharmacist is present at the table. So that elective is also inclusive of medication reconciliation, medication therapy management, and then consultant pharmacy. The APPE works closely with the pharmacist and the resident at the high-risk conference to make recommendations And then because the nurses have enough on their plate as it is, we select the higher risk patients where the pharmacist and the APPE reach out to the physician, make the recommendation for the change, make sure the change is implemented, and then they document it in the nursing EMR and update the medication record. And this is another opportunity where if you're interested in residency, you would be working very closely with our resident and their pharmacist preceptor. The other elective is a pharmacy management elective. I am the preceptor for that. So I oversee our retail pharmacies that I'm describing here. I also oversee the home infusion pharmacy located within the Visiting Nursing Association. So my role as a director is a dual role, triple role maybe, as supervising pharmacist. I'm the pharmacy manager, and then I'm the director of all the community-based services. So I tailor this rotation to what you are looking for out of it. If you are really driven to be a supervising pharmacist or a manager, I tailor the rotation to those tasks. If you're interested in healthcare administration, I can assign projects to that. I usually customize that rotation to whatever you're looking to be exposed to, or if you know what you want down your own career path to help prepare you for that. And then the last elective we offer is a compounding elective. So at Buffalo General, because it's on the medical campus, we serve Oshai Children's Hospital as well. And there is a significant amount of non-sterile compounding that's individualized medicine for all of those peds patients. So we do offer an elective in pediatric non-sterile compounding. So any combination of these, 2 or 3 of these rotations, can be forged into a longitudinal. We've had a lot of success in the past taking students, probably for maybe the last 5 or 6 years. This is a unique community site. Because we are embedded in a hospital health system, you can get exposure to any piece of a health system through our community pharmacy. And because of our residency program, if that's something you're interested in, you'll be spending time with our resident, and you can get a really good inside look at what that experience may look like, if that's something you would pick in the future. So if there's any questions, my email is on the UB website, and I'd be happy to answer them for you. Good luck in your professional year.